The life of a respiratory therapist. Many people actually do not know what a respiratory therapist is, or even what they do. A respiratory therapist is a medical professional who specializes in the cardiopulmonary system and treats many different people and diseases. Being a respiratory therapist is a very versatile job. You can go from being in the delivery room, helping to deliver a baby, to being in the emergency room, helping with a trauma patient, or being on the floors giving a nebulizer breathing treatment. While on the general floors, we use these simple yet common devices to give breathing treatments to our patients. Many of us have seen or even used these devices before. These are inhalers, nebulizers, and incentive spirometers. We can even work in the operating room or delivery room, helping to stabilize or resuscitate a newborn. We have to work when they're born to clear and support their airways. I'm sure we've all seen these devices before. While in the emergency room, we help our patients during emergent situations. We can help by performing CPR, by either helping with chest compressions or breathing for the patient by using a bag and mask device as shown below. These are used to support the patient's life in critical time situations. While working in the intensive care unit or ICU, we provide care for the critically ill. Some examples would be operating a ventilator, which is a machine that breathes for the patient, or caring for patients who have a tracheostomy, or also known as a trach. This is a small tube that we place directly into the trachea to ventilate our patient. Some patients are able to leave the hospital, but still may need continuous care. These patients are then sent to live at a long-term care facility. There are pediatric and adult facilities. As a respiratory therapist there, our job is to maintain the ventilators or whatever breathing device is used. If there is a patient who is able to be discharged from the hospital, but still may require care, and the family does not want to send them to a long-term care facility, they can go home and have a team come out to the house daily to care for them. This team is consistent of a respiratory therapist, a visiting nurse, and a physician assistant. We also provide outpatient care to many people. We can conduct special lung function tests to determine if there is any restrictive or obstructive lung diseases. In this, we can also tell if there is a problem with the lung being able to absorb oxygen properly. We can conduct overnight sleep studies to help diagnose patients who are suspected of having sleep apnea. It's actually a common condition where while sleeping, you go apneic, or in other words, you stop breathing while asleep. This is very common in people who tend to snore. There are so many people who wear oxygen at home, and it is part of my job as a respiratory therapist to check in on these patients and adjust their oxygen levels as needed. Part of this is done by making home visits. I go out to their location, check their tanks and oxygen reservoirs to make sure they are adequately filled. In the hospital, we work alongside different teams and physicians while performing exams. An example of this would be a bronchoscopy. A doctor inserts a camera into the airway to look for abnormalities, and it is our job to draw up the medications needed for the exam. As a part of the patient care team, we work closely with nurses and doctors. We assess our patient and then give our report and opinions to the rest of the team so we all have an equal input when it comes to providing care. Patient education is a major part of my role as a respiratory therapist. How could I send someone home with a new medication or breathing device but not even educate them on how it's used or the significance of it? This is part of my job, as I make sure the patient is able to understand and properly use the device once they're sent home. I'm sure we have all seen or heard of a doctor who is cocky or acts like a know-it-all. In my world, I can also educate my coworkers on current respiratory techniques and protocols. This helps to show doctors and other professionals how important my role is and why I'm there. The lung and heart works hand in hand with each other. The lungs oxygenate the blood, and the heart then pumps the oxygenated blood out to nourish the body. An example of a cardiopulmonary support device we operate is an ECMO machine. This is a heart and lung bypass machine. It's a machine that does the job of the heart and lungs when the organs fail to do so. This is used for severely ill patients. Not only do we treat our patients, we also take care of their families. It is extremely difficult when seeing your loved one sick in a hospital. We take the time out to explain different procedures and processes to the families. We comfort them in their time of need. The job outlook for our respiratory therapists is steadily rising and will continue to do so as many health systems are now beginning to recognize the importance of us in the workplace. Overall, respiratory therapists are currently in high demand and play a significant role in patient care teams and in healthcare systems worldwide. We can work in many different places: outpatient, inpatient, home care, many different places. Please keep in mind how important our jobs are.